All right, so I'm going to introduce our speaker today for the Career Spotlight of Dentistry. So Dr. Michelle Robinson completed her undergraduate degree at Adelphi University in Garden City, where she received her bachelor's degree in biology. She then went on to complete a Doctor of Dental Medicine degree in Newark, New Jersey. She spent 8 years in private practice before completing a master's in medical informatics at Columbia University. She then came to UAB in 2005 to join the UAB School of Dentistry, where she serves as a senior associate dean and a diversity and equity action officer. So without further ado, I introduce Dr. Michelle Robinson.
Thank you. Well, I have been tasked with talking about something that I love, and that is careers in dentistry. And there's a lot of options in dentistry. I think dentistry offers a landscape of different careers that you probably haven't thought about. So I'll try to highlight that today. So I'm going to share my screen because I have some slides to share with you. And we will approach it that way. All right, so our career spotlight is obviously on dentistry. And you heard a little bit about me. Currently, I'm serving as the interim dean for the School of Education. Previously, I've served as the interim dean for the School of Dentistry. And you heard a little bit about me working in diversity, which sounds like it has nothing to do with dentistry, but I am passionate about diversifying what dentistry looks like. And so I work in that area as well. And then you heard a little bit about me getting a master's degree in informatics. So I also have interest in computer information science. And on the bottom here, this is from a panel that I worked on that did some research and published some work. And so I've been able to take dentistry and move it into dental informatics. So applying dentistry to the field of computer science. So what is dentistry, and why would somebody want to do that? So every year the US News World Report comes out with a list of the best jobs. And so I'm going to show you, let's see if I can get this to load, the best jobs for 2021. And sometimes that takes a minute to load. So I think I have it already here for you to see. And here we go. All right, so this is America's Best Jobs in 2021. So this isn't something I have made up. This is their real best jobs. And we're going to take a quick look at this because as you're picking a job, you want to pick something that you like, and then you want to pick something that people in America consider to be a good job. So if I hit here, browse the complete rankings, you'll see 3 categories come up. And we have the category of 100 best jobs, best healthcare jobs, and then best paying jobs. So if we go to 100 best jobs and we start there, you're going to see these are ranked from number 1 to number 100. And dentistry was number 1 for 5 years straight and is currently, let's see back here. I think I went back to the other link. All right, so back here, we're going back to 100 best jobs. And we're starting with number 1, we're going down. And I was saying that dentistry has been number 1 for about 5 years. And now we are number 9, right? And some of that has been affected by the pandemic and having to be closed. But 9 out of 100 is still pretty good. So dentistry is number 9 out of the 100 best jobs. And remember, we've been number 1 for 5 years. But more important is if you look at best healthcare jobs, so now these are just the healthcare. So it's taking all the software developer and all of those things out. We go in, and so now these are just healthcare. And there's dentist number 5, and that's a general dentist. And then number 7, which is an orthodontist. Most of you know what that is. Number 9 is an oral and maxillo-facial surgeon, right? That's a dentist that pulls teeth. So that's us again. And then we've got prosthodontist, which is number 13. That's another dentist. So we have like 4 already, and this is just in the top 15. So very impressive. And again, these are all things you could do in dentistry. And then, of course, because I know you're interested, if you want to see the best paying jobs, because right, we're all interested in what we're going to get paid, even though we don't do it for the money. It'd be interesting to look at this. So we have anesthesiologist, surgeon. Number 3, that's a dentist. And so as opposed to the jobs ahead of it, does not take as much time and schooling as the 2 jobs before it. So that's kind of something that's really impressive regarding dentistry. All right, so back to the PowerPoint. So that's one of the reasons why we would want to do it. It's actually a fun career. It's very rewarding. You have a high profile as a dentist, and it's a great career. Besides dentistry, we've got these 4 things that you can do, and dentistry is one. And so besides being a dentist, and we've got all these specialties within dentistry, you can be a hygienist. And if you look down the list of 100 best paying jobs, hygienist is in there as well. I think they're in the 20s. Dental assistant, which I believe is either in the 20s or 30s, and lab technician. So they're all, before you get to number 50, they're all there. And the hygienist, as you probably know, is the person that cleans your teeth, right? And so this is the person that works alongside the dentist. This is a very busy job. Hygienists have their own patients, just like dentists. So it's a great way to have the autonomy without going all the way into dentistry. You learn a lot of the beginning stuff of dentistry, and then you're mostly in charge with keeping the gums and teeth clean. Dental assistants are the ones that actually help dentists. This varies state by state with what's required. The UAB has a dental assisting school. It runs about 9 to 12 months. You can also learn in office. If you move to another state, it may or may not require certification. So this kind of changes, but this probably requires the least amount of schooling. Also very rewarding, helping the dentist to achieve those great results with patients. And then lab technicians, this is the artistic side. These are the people that design all of the false teeth that you see, the beautiful teeth that you see people wearing. Those are designed by the lab technicians. So the whole team kind of works together to make dentistry work out. So we have the dentist, hygienist, assistant, and then the lab technician. This is a picture of our lab. So this is for students, but a lab technician would work in an environment like this, where you see all of the students at tabletop actually working on fabricating teeth. So that's kind of what that looks like. We use this for teaching purposes. So the first 2 years that students are in dental school, they spend their time here working on a mock patient. So it's like a model of a patient with teeth, and you can see the picture here. And they also do their dental lab work here as well. So dentistry is the art and profession of being a dentist. And we are skilled to practice dentistry. Essentially, we're physicians, but we're physicians who focus on the head and neck. And we also look at indicators of systemic health issues. So we do complete medical exams like physicians, and we look at the head and neck area to see how that might impact anything else going on with the patient. We prevent, we diagnose, and we treat diseases. We also treat injuries, malformations like in orthodontics, and then we treat soft tissues, and then we also make and insert false teeth. What we do is influenced by everything that influences medicine: genetic engineering, the discovery between oral and systemic diseases, development of salivary diagnostics. What does all this stuff mean? So let me give you an example. Genetic engineering. I've heard people say, my teeth are just soft. That's what runs in my family. Is that a real thing? So we do genetic studies to figure that out. Also, what we're doing with genetic engineering is we're looking at ways to grow teeth. So taking stem cells and growing teeth that are missing. So this is something that's going on right now that we're doing in the lab scenario. Links between oral and systemic diseases. So did you know that a person who's pregnant or who has diabetes, that keeping their teeth and gums clean actually helps them have better outcomes? So having poor dental health could result in smaller weight babies. Having poor dental health can also mean your diabetes is more out of control. So these are the links there that we look at. Salivary diagnostics, that's an area that at the School of Dentistry at UAB, we're actually doing a lot of research on right now. And in the summer, we have the Summer Health Professions Education Program, where we actually let students come in and use salivary diagnostics on themselves to see if they are genetically prepositioned for certain oral diseases. Isn't that cool? You could see, am I going to get more cavities than other people? Is there such a thing? So those are things that we work on in terms of studies. This is an example of one of our studies. I'm going to play this video. This is really cool, but just explaining what it is. So if you have a cavity and you need a filling, you usually go to the dentist and they drill on your tooth. And after they drill it, there's all this noise and there's water and stuff flying around, and then they fill it. Well, our research has found a way to not do any drilling and any filling to get a cavity done. What we do is we use acid, the safe acid, to etch the tooth, right? And we etch away all of the cavity stuff, and then we put a new filling in. And that was developed here at UAB School of Dentistry. This is a clip from the news that I'm going to show you.
Where was this technology when I was a girl?
Can you hear it?
I can't hear it.
Okay. Let me see if I can turn it up. All right, so I'll talk through it. So that's the etch right there. So instead of drilling a hole in the tooth, right, he's using a compound that's called an etchant, and then he sprays the tooth, and this is what actually makes the hole, right? So then he's gonna rinse that off, right? And so now he's gonna go through and do that again. And he's looking to make sure that he's got the area etched completely. And so once that's etched, then he's gonna go in with another compound to actually do the filling. And when he puts that compound in, he will use a laser light source to actually harden the compound into place. So that's what he's doing. So it's actually quite amazing. It can't be done on everybody. You have to have a smaller cavity for this, but this was really groundbreaking when it came out a couple of years ago. So those are the kind of things that we do. We prevent, we treat, and diagnose, right? So those are our three main goals. And the main areas that we work in are going to be the mouth, which is the oral cavity, the teeth, the gums, the jaws. And that includes everything, including the tongue, the inside of the cheek. So all of these areas are what we look at. So when we do an exam, we're not just going, and we just look at a couple of things. We're looking at all of these things listed here. All right. So prevention is really important to us because it's not all about, having work to do to treat a patient. We also want to arrest the cavity process before it happens. We want to prevent you from, if you're playing sports, we want to prevent you from getting injuries, related to sports. So we create mouth guards for things like that. The picture that you're looking at here is nutrition discussions. These are our students. They have gone out into the Birmingham elementary school system. They do this every year to do a program called Lessons in a Lunchbox. And they're using SpongeBob to teach elementary students about the importance of home care, brushing, and flossing. And also what is a sealant and how sealants prevent cavities and the importance of getting fluoride. So the students do this every year, and those are our students in the picture. Diagnosing. So diagnosing is great because it involves first interacting and listening to a patient. So a patient comes in and you ask, this is who I am and who are you and what can I do for you? And so it starts a conversation. The patient gives us their own words. They talk about a problem and we try to solve it. And it's a very rewarding feeling. If you like working with people, it's really great because it's one-on-one and it's close. It's different from when I go to my physician, who's a doctor, because after I have that conversation, I don't feel like, there's no direct treatment to solve my problem that doesn't involve a lot of prescription writing or surgery. The dentist gets to talk about something and then fix it right away. So somebody says, I have a toothache, and you get to diagnose that toothache through various means and then, solve the problem. So how do you do that? You're going to do a visual examination. And this is just a picture of students doing a visual exam on a patient. And you're going to do some clinical exams, and then you're going to take some x-rays, right? So x-rays are really important to the diagnostic process. We have regular x-rays, and now we have 3D imaging, which is really cool. This is a regular x-ray called a Panorex, and it just shows the entire mouth all at one time. The white areas here, those are fillings. So this patient has fillings. And then if you look on the bottom, this is a patient who's probably about your age. And these are their wisdom teeth that are coming in at the back, right? And then this patient has some crowding here. So this patient's gonna need some orthodontics to straighten their teeth. This is the machine that we use to take x-rays. And this is what it looks like if you take just a picture of a couple of teeth. And these are anterior teeth in the front of the mouth. These are the smaller ones. These are the bigger teeth in the back of the mouth. And then this is a 3D image. So 3D image, you get the head and you get all these other structures with it. Dental diseases, this is a very important thing to fix for a patient because they affect not just the whole body, but in the mouth, your teeth have hard structures and soft tissues. The hard structure is the enamel, the white that you see on your teeth. And then beyond that enamel, you've got this right here is the nerve of the tooth. This is soft. The tooth is sitting in bone. That's another hard structure. And then the bone is covered by gums, which we call gingiva, and that's a soft structure. So these are all things that we teach the students about when they come to dental school. This picture here, I was just explaining some common dental diseases. The one on the top is something called baby bottle decay. These are babies who go to sleep every night with a drink that's sweet. Sometimes they put honey in it. The moms are doing that because it helps them sleep. But having them go to bed every night with a sugary substance and then going to sleep and not rinsing that off, this is the result. So this person will come to a pediatric dentist to fix that. On the bottom, we have an adult patient. The tongue has this white structure on it. That's called thrush, ending with SH. And that's actually a viral disease that actually is cured by just a prescription. But it's just the gamut of things that we do. This patient was born with a congenital abnormality. So this is a cleft lip. When these patients come and present, this is a team effort. So the dentist will work with specialists. So the general dentist and specialists will work together. And sometimes we have surgeons from other fields in medicine to help with this. Sometimes the ENT, and ear, nose, and throat surgeon will work with the dentist on this. It'll be the dentist, the orthodontist, the ear, nose, and throat surgeon. They all get together, and it's really great because I've watched them over Zoom even doing this. They have like a little conference where everybody has their pictures, and each person talks about the stage of recovery for this patient and what their role is going to be. And it's really a great thing if you like to collaborate and work in that way. So that's part of what we do when we treat. We fix what's broken. If we can't fix it, we replace it. That's what we do. And then we have things that aren't real big problems, but we even look at, whitening, and we talk to patients about, the crest white strips, and what can I use the white strips? How can I get my teeth whiter? So we deal with everything from small to big. We restore teeth. So when missing tooth structure, and when we do that, we're looking at the function and the aesthetic. So it's not just about the way it looks. If you're missing your two front teeth, well, that looks terrible, especially for an adult. But how do you bite an apple like that? How do you eat ribs? So the function is really important to things as well. So we have a number of specialties. I'm going to run quickly through these in dentistry. And for each of these specialties, again, don't forget we have the hygienist, and we have the dental assistant, and we have the lab technician. They're all a part of the specialties as well. The prosthodontic specialty deals with replacement. So if you look at my picture here, this is just a basic example. A tooth is missing. The prosthodontist would go ahead and prep these two teeth adjacent to it, create a replacement involving all three teeth, and then cement this in. A general dentist can do this as well, but prosthodontics will replace 20, 30 teeth at a time. They just do it in, on just a much bigger scale. And there are specific dental assistants that work with prosthodontists. So they learn to work with them as a specialty. And so this is an area of prosthodontics called maxillo-facial prosthodontics. I like to show this because no one would believe that a dentist would be replacing a nose or an ear. These are our patients. This is the before. This patient's nose was gone because of cancer. This patient had cancer from smoking. And this is the maxillo-facial prosthodontics that replaced the nose of this patient. So quite amazing. This patient lost their ear. This was a traumatic injury that resulted in the loss of the ear. And again, a maxillofacial prosthodontics, a person with a dental degree, replaced this patient's ear. And that's all this person does. We don't have that many people with this specialty in the area. There was a time when we had patients driving from 5 states away to see our maxillofacial prosthodontist. And so we have amped up that program so that we can have more of these people to treat the patients that need them. Periodontics is for people that have gum disease. So this is a picture here. You can see that the gums here are not all pink. They're a little bloody and it's not smooth and it's a little puffy. And then this is the healthy gum. So the goal of the periodontist is to get from unhealthy gum and the tissues, the bone around the gum to a healthy situation, right? And so here's just a little picture that shows the stages of how that advances. And they have various tools they use. They do surgery, special rinses, brushing and flossing, and hygiene instruction. The hygienist works very closely with the periodontist. So periodontists tend to hire many hygienists in their office to help and work with them. So that's where you see the hygienists working a lot. And so they will also do surgery. Here's an example of a surgical procedure. This patient, the gum should not be this high. You're not supposed to see this part of the tooth. So what they did was they took some extra gum from this patient's palate and they actually implanted it into the space and had it fuse and grow in together. And it looks really natural. So really great what they do. Many of you have heard of root canals. Hopefully you haven't had one yet, but a root canal is done by somebody called an endodontist. And in this picture, you can actually see what the tooth looks like when it's open. So here's white, here's the enamel, which is the outside of the tooth. This patient has a diseased root, so they need a root canal. What is that? All we do is we actually take all of this diseased root out. We have these tools here. You see these long sticks. We have these sticks and we can remove all of the diseased tissue and then we replace it with replacement tissue. And then the patient just goes along with the replacement tissue. And it usually works fine. And it's like they have a new tooth, but it's the same tooth with just a replacement of the nerve. Oral surgery, this is a huge area in dentistry. They diagnose and treat injuries, they treat diseases, they do lots of surgery. So they do the wisdom teeth extractions, which most of you probably know, they pull teeth, but they do a lot more besides that. So we talked about the wisdom teeth, which are the third molars. And here's a picture here of what that looks like when they're doing actually the surgery. But they also take care of infections. This tooth here has an infection. Let's see if I can, I'm gonna blow that up. See, there's like a light area around this tooth. That's a cyst. So there's an infection on this tooth. So that tooth has to be removed, right? So we can't wait for that to develop and grow into the mouth. They got to take that out. So those are things that they do. And then here is part of the surgery on that same tooth. So for this, if you're going to go into this specialty, you can't be bothered by blood because you will see it a lot. It's not like that for all the specialties, but this one, here's another one. And I took out most of the bloody pictures, but this was a patient that got into an accident and fractured all of the bones of his face. And so they had to do surgery on him to actually fuse all those bones back together. And then he is going to wear this device for about 6 weeks until all the bones can get back into correct alignment with each other. So he'll have to be on a liquid diet while that happens. So that's called an external bone fixation, but he's going to be like new, which is amazing considering where he came from. If you're interested in orthodontics or if you've had braces before, you know what they do. They align the teeth. And we do this for children as well as adults. There's a lot of people that come to us as an adult and they haven't had their correction done, and we can still do it as an adult. Pedodontics are dentists that only work with children. And another area where, again, all of the specialists are very important. The dental assistant for the pediatric practice is huge because this has to be a person that likes children. This is the person that introduces the patient to dentistry. plays with them. A lot of the pediatric practices will have toys and they give out little gifts to the kids. And so the dental assistant is really important in that process, as well as the dentist. And this is just some pictures of putting sealants on the teeth to prevent the child from getting cavities later. We also have radiology, oral pathology, public health, where you kind of look at dentistry for an entire population of people. So lots of areas that you can go into. Here's a couple of before and afters, so you can kind of see why we get so much satisfaction out of dentistry. So this is the before and this is the after. This is what this patient looked like coming into us. All the teeth over here missing, all these teeth broken down to stubs. And now they've come in and we have fixed that with a denture. There's a dent, you can see the metal here, that's for the denture. But this patient now looks amazing and they have their function back. Look at this one. Who would think you could do from this to this, right? So these are incredible cases, but this is what we can do. So this last one, these are the lower teeth, and that's what it looks like after, right? And so these are not incredibly difficult cases once you've been to dental school and you've had some experience. So how do you become a dentist? So you've got your 4 years of high school, and some of you will be taking college prep courses, and then you'll go to college. College is usually 4 years. Some people go longer, and you can actually do it in 3 years if you take all of the prerequisites for dental school, right? But you have the prerequisites usually involve biology, chemistry, physics, and calculus. Then you go to dental school. Dental school is 4 years. The first 2 years, we do what's called integrated basic sciences, which means we do basic sciences and we combine it with dentistry, so that you're not just sitting in the classroom all the time. You're doing classroom and then linking it to patients. So it's kind of great because we do a lot of patient case studies and we link all of the basic classroom stuff with that. And then at the same time, you're learning how to drill on your plastic teeth on your mock patient. And so you get to do all of that at the same time. The third and fourth year, you mostly would spend in clinic actually treating patients. So you start off with easy treatments, and then you kind of build up to more difficult things. After 4 years, graduation, right? And then after graduation, you decide, well, what do I want to do now? If you stay in general dentistry, you can do a little bit of everything that I just talked about, right? So you just do a little bit of everything, or you can go into a specialty, and the specialties range from 2 years to 6 years. The longest one is 6 years, and that's the oral surgery, right? That's the one that pays the most, and that's the one that takes the longest. But still, that means that with dentistry being 4 years and oral surgery being 6 years, that's a total of 10. That's our longest one, is 10 years from college. Whereas if you go into medicine or a lot of the other careers, 10 years out, you still have to go to more schooling. So by far, this is probably one of the shortest in terms of specialty. There's a lot of personal satisfaction that we all get being in dentistry. We help people. We have one-on-one relationships with patients. We advance science, like I talked about. And then there's a creative piece to being able to make the teeth, the molds, the ears, if that's what you're doing. It's very prestigious when we tell people, you know, you're a dentist. You know, we have a lot of gear with our name on it. And so I like to wear my UAB dentistry gear, and somebody will always ask me, do you work at the dental school? And it's very prestigious. I love it. And then you can own and manage your own business if this is something that you want to do. And I had a business for a short time, but was really interested in teaching. So I gave that up to come and teach. You know, it does cost some money to go to dental school. There's tuition, books, fees, and living costs. State schools are way cheaper than private schools. So one way to cut down your costs is to stay at a state school if you're based here in Birmingham and you're a Birmingham resident, then our school is going to be the cheapest option. And you can pay for it various ways. You've got loans, military service, scholarships. We do give out scholarships to a lot of our students, merit scholarships in particular. If your parents win the lottery, that's probably the best way. But you've also got the military and National Health Service Corps. And the way that that works is that in exchange for some time in the military, they'll actually pay your tuition. And when I say military, I'm not talking about, you know, the basic training and running around and doing 1,000 push-ups a day. You're going to be a professional in the military. So the students that do this when they graduate, they are actually going to work in a dentist's office that belongs on a military base. So that's all that means, right? They pay for your dental school for 4 years, and then you would do the equivalent on a military base in a practice. And sometimes you get to start your own practice. I almost joined the Air Force, and the way that was going to work, because of the timing when I was going to be coming in, I was going to get my own practice in San Diego, and that would have just been awesome. I did not do it, but that's because I ended up getting a scholarship from the school that didn't have any strings attached, so I took that instead. There's also the Indian Health Service. There's loan repayment programs that they'll give you money to pay back your loans if you work in areas with dentist shortages. So your career options are private practice, academics, which is what I'm doing, informatics, what I still do, but what I started off doing with informatics is designing computer systems for hospitals and dental schools so that their patient records could be electronic. And that was really fun and rewarding for me. You got military service, institutional service, which is where you work for like a state dental director. The state dental director was super busy in COVID, like constantly having to give updates and let us know as dentists, are we allowed to see patients? What are the rules? What are the guidelines? So that's an important role as well. And then there are people who just do research. So they don't see any blood, they just do research all the time. Average income for a dentist is about 200,000 if you're a general dentist and 300,000 for a specialist. Oral surgeons, they make anywhere from 350 up to 1.5 million. So they make a ton of money for that extra 6 years that they spend. And then this is what I do, the dental informatics, and I would just have this slide in there just to say, you know, if you have an interest in computer science and dentistry, you can totally make that into a career. This is one of our previous faculty members. He does military service, and he's teaching, and then they will ask him to be deployed to go and help see dental patients overseas. And so he's been overseas, and so this is just him with his gear on. I talked about institutional service, so those are like public health dentists, but also you have people working in prison dentistry, and then in school dental programs as well. Research, so we have an entire research program. We have research programs also for students that are in high school and college as well. So if you're looking online, our program is called DART, D-A-R-T. And if you're interested in dental research or just in getting involved early on, you should look for the DART or the pre-DART program, which some of you would be eligible for. This is academics. So this is me with a bunch of my students after a recruitment program. We just took a picture, and this is just something that we all love. And so I'm trying to talk some of them into coming back to teach. Most of them are going out to be general dentists and specialists. And I think some of them will come back and teach. So that's the end of my segment. I'm going to stop talking. And if there are questions, I'll take them. And then if not, I hope that you enjoyed this presentation.
Can you tell us a little bit about what brought you to Birmingham?
Yes. So what brought me to Birmingham was I had gotten my computer science informatics degree, and my plan was to go to dental schools and to help them design electronic patient records for their schools, and to get the schools online using, online learning formats, and then just go from school to school to school. So I spent 5 years at my first school. I came to Birmingham to spend 5 years at that school, and that was in 2005. So I just never left because things just kept evolving and happening. The computer science world just exploded. And so I ended up staying there. But that's what I came for.
I have another question. So I know that you spoke about like teaching in dentistry. Have you taught in any other areas? Like, what's your connection to education outside of school dentistry?
So it's interesting now. So in October, I was asked to be the interim dean of the School of Education. And so for those of you who are in high school, you know, the dean is like the principal. So it's like being principal of the dental school and now being principal of the School of Education. And so the Gear Up program is actually one of our programs in the School of Education, right? So in the School of Education, we are teaching people to become teachers, right? But we also have a component where we are teaching students in the STEM areas. So the science, technology, math, you know, those areas as well. And so we have a lot of students who are, they're interested in the science and technology arena. And even though they're in our school, they're actually planning on going to medical school, dental school, nursing school. And this is just one path for them. So some of these students are going to end up going to teach high school, and they're going to do that for a while. And then they're going to come back and apply to go to medical and dental school. So it's amazing. So these are people that have two careers. So I'm kind of doing both now. I'm still at the dental school and I'm at the School of Education. And when I do outreach like this, it's so wonderful how everything just gets pulled together, right? Because I've got Gear Up, and then I've got the fact that, you know, you all are listening to a presentation on dentistry.
Awesome. So I have one more question. When thinking about what life looks like post-COVID, what are some of your aspirations for the next few years?
So one of the things I want to do is, in terms of recruitment, I think that now, because of being cut off and because people's economic situations might have changed, that we're going to have to go at the recruitment a little bit harder and really put our focus on making sure that people from diverse backgrounds have opportunities. And the best way to do that is not just the outreach and doing presentations like this, but offering scholarships and having more money available to people when they come to do these careers. So we're going to be working on hopefully gathering more scholarships. I think now that we know we can do a lot of these things via Zoom, we're going to go back to face-to-face, but I think we're going to keep this format because it allows us to reach more people. And just thinking about the fact that the people who aren't at this presentation now can watch it later, whereas if we were doing this face-to-face, if you show up, you show up. If you don't, you don't. So now we have this other platform. This is going to allow us to expand, you know, our reach and who we can get to. So I think that's going to be really important, not just on the recruitment side, but let's talk about patients. So now we can do teledentistry. We can reach patients that are way out in areas where there's no dentist. And we can talk to the patient before they drive 4 or 5 hours to come in and see us, right? We can't do any work over the Zoom, but wouldn't it be great to tell a patient exactly what they need and save that drive? Because right now they drive hours and hours, they come and then we go, oh my gosh, this is what you need. But you know, we can't do it today, you're gonna have to come back. Well, now we've got this technology and we can say, okay, well, let's do the visit over the internet. And with my background in informatics, I designed a telehealth system for the dental school. So we did do that during COVID, where we had the patient use their smartphone and we gave them a set of instructions and they opened their mouth and we give them a way to use their smartphone, the camera on their smartphone to show us what their mouth looks like. And then we can actually make decisions and say, okay, you don't need to come in, you're doing good, or you do need to come in, and we can arrange for them to see the right person. So this has opened up all these different tools that we had all along. We weren't really taking advantage of them.
I love that. I know I said that was my last question, but I love it because I think that it brings to mind a constant barrier with urban and rural areas, which is like digital divide. So I love that you all are finding ways to close that digital divide. And even though you're in dentistry, you're still working with computers, you know, to make sure that you're able to provide that to your to the people that come see you. So I think that's pretty awesome. And I'm looking forward to seeing more so of what you create, because I feel like you still have some more stuff up there ready to come out.
We've got stuff coming out. We are working with someone now in the medical school on teleshadowing. That's going to be exciting. So normally to shadow, you've got to find a dentist and go into the office and watch them. And, the idea of teleshadowing, I thought, oh, it's not as good as coming in. But now that I'm starting to pilot it, I think it might be better, because with teleshadowing, we're going to use an intraoral mouth camera. So you'll be able to see better than if you were actually in the office. Because when you're in there, you're kind of just looking over somebody's head. And now with the teleshadowing, we're going to have the dentist take this specialized intraoral camera, put it in the mouth, and kind of go around, and you'll be able to see everything. So this might even be a little bit better. So yes, more to come. But thank you for having me. I have totally enjoyed this. And I put my email on the last slide. So anyone that's super interested in dentistry or trying to get information on the DART program, you can just send me an email.
Dr. Robinson, can you put that last slide back up again?
Surely. There it is.
Thank you.
You're welcome.
Thanks so much for taking the time to speak with us today. Your knowledge definitely is something that I appreciate and I've learned a lot from. I think your excitement was was something that I really appreciated, though. Like, I can tell that this is something that you really care about and something that you're passionate about. And it's always great to see people not only doing a career because it's a way for them to make money, but doing it because it brings them joy. So just thank you for being a professional who is actually still enjoying their job and doing it because they want to. So you can see that joy all over your face. And I really hope that I'm able to learn more about what you're doing in the future, and the students are as well.
Thank you. Thank you, the two Carolyns and Jean-Paul. Thank you very much.
Thank you.
You're very welcome.